Today, we're talking about treating insomnia without medication, and I'm delighted to be joined by Dr. Sarah Silverman. Dr. Silverman is a Stanford-trained holistic sleep specialist and insomnia expert who's passionate about sleep health and wellness. Dr. Sarah uses a personalized, mindfulness-based approach to help improve symptoms. Notably, she is an expert in cognitive behavioral therapy for insomnia, the first-line drug-free treatment for adults with chronic insomnia. CBTI is an effective way to improve sleep naturally and overcome chronic insomnia without medication. And before we jump in to our conversation with Dr. Sarah, I'd like to invite you to subscribe to this channel. This channel is all about holistic sleep education for physicians and therapists. Subscribing and liking this video is going to help get this information out to more people, so go ahead and do that. I'm Dr. Nishi Bopal. I'm a physician specializing in integrative psychiatry and sleep medicine. So thanks, Dr. Sarah, for joining me today.
Thank you so much for having me, doctor. It's a pleasure being here.
Yeah, and I'm really excited too, because we are doing a women's sleep summit together. It's online, March 4th and 5th. Do you want to share a little bit about what the summit is all about?
Yes. So excited and looking forward to this. So yes, March 4th and 5th of this year, we're going to be hosting an online virtual sleep summit for women. And it's going to be jam-packed with so much great information, but also a lot of actionable steps to learn how to really prioritize sleep and improve sleep. And I think we're going to be joined by 6 other women. So that's exciting, who are all sleep specialists, sleep physicians, sleep coaches, sleep psychologists. So we have a really great group of women who are going to be talking about various aspects of sleep health and really great ways to improve the quality of your sleep. So definitely looking forward to it.
Yeah, me too. It just sounds really exciting, and I'm excited. You know, there's the 8 of us, and yeah, we're going to be talking all about women's sleep health. And one of the reasons we're so interested in this is because women are underserved when it comes to clinical sleep research, when it comes to clinical sleep treatment. And I know I see women in my practice who are misdiagnosed, underdiagnosed. I'm sure you see the same. We'll talk about that today a little bit too. So yeah, this is our mission. Like, we're really excited about spreading the word of women's sleep health.
Yes, absolutely. And that's such a great point. You know, especially when it comes to having insomnia, women are at a much higher risk for developing insomnia. I think 40% higher risk than men for developing chronic insomnia. So it's something that I see a lot of and often goes overlooked by a lot of primary care family docs. And, you know, a lot of doctors aren't even asking their patients about their sleep. So it's always something, especially for the women I work with, I always encourage them to really speak up and talk about their sleep if it is something that they're noticing is getting disrupted, or, you know, maybe they feel like it's not restorative or restful sleep. It's definitely something that for most people you have to speak up about in order to get the right support.
Absolutely. And so let's dig into that a little bit more. And before we even do that, so if people are interested in signing up for our summit, we'll put the video link in the description below. So, or rather the sign up link in the video description below. And then we'll put the sign up link on the screen here. So you can go ahead and sign up. It's free. Everyone is welcome. It's for women, whether you are just interested in learning about sleep, if you're struggling with sleep, or if you're a healthcare practitioner who wants to learn more about sleep, go ahead and sign up. So that's a great point you just made, that people need to go and speak to their healthcare practitioners about sleep. I know there was a study a while ago showing that only about 5% of people actually make an appointment to go and talk to their doctors about sleep when they're struggling with sleep issues. And another small percentage, I don't remember the exact stats, will even bring it up during a session, whether they're seeing their psychologist or their physician for another issue. So a few questions there. What are things that people should be talking to their doctors about? What are some reasons they should be talking to their doctors about sleep? And then on the other side, for healthcare practitioners, what should they be asking their patients about sleep?
So I think actually I'm going to go back to what you were just saying. I think that, at least I heard the statistic that only 12% of primary care doctors will actually ask their patients about sleep in the US. So that's, very small number of folks who are really thinking about sleep. And so that means most people aren't talking about their sleep. yet, sleep is the foundation for optimal health, and sleep is, we spend a third of our lives sleeping, and it's something that's so universal to all humans. Like, we need more healthcare providers to be asking about it. So some of the things to look out for in terms of your overall sleep health. So things like, are you having difficulty falling asleep, difficulty staying asleep, or if you're waking up during the night, is it a challenge to get back to sleep? Are you waking up too early or earlier than desired? Are you noticing changes during the daytime? So things like, are you noticing that your mood is changing? You're more irritable or cranky? Noticing changes in your ability to concentrate or pay attention, remember things? Are you also noticing that just overall, no matter how many hours of sleep that you get, it just doesn't feel like it's restorative or restful sleep? And that, I would say, is a really big one. Sometimes, I'd say it looks a little bit different for everyone, but one of the common themes that I see is that usually, even after a night of, say, trying to get 7 or 8 hours of sleep, it just doesn't feel restful. And then, of course, that can lead to some of these daytime changes during the day: fatigue, brain fog, noticing changes in concentration and more cognitive effects, and also just in terms of how you function during the day. A lot of folks will then end up canceling appointments or not going to things that they might normally go to because of poor sleep. And that can sometimes just make the problem worse. So I would say those are kind of the classic signs to look out for when it comes to sleep disruption. And if that's happening on a regular basis and, the majority of nights per week, that's definitely something to bring up with your healthcare provider. And then
sorry, go ahead.
I was going to say, on the other side of this, so the healthcare provider side of kind of bringing up sleep or things to ask about, I would say even just the question of, are you having any difficulty falling or staying asleep? Do you feel like your sleep is restorative? Are you noticing changes during the day in terms of your mood and the way that you feel and function during the day? And one of the other big ones is, are you napping or dozing off during the day? Are you sleepy? Are you actually falling asleep during the day? So kind of getting an inventory of those classic signs when it comes to sleep health.
Absolutely. No. And what I was going to say is that it was really helpful when you were listing out all the symptoms that people should look out for and, reasons they should talk to their healthcare practitioner. Because I think a lot of people live with those symptoms thinking that they're normal, that everyone's tired, everyone can't sleep, and, everyone has problems with focus, and it's just something you have to deal with, when actually many of these symptoms are highly treatable and can be traced back to insomnia or even other sleep disorders.
Absolutely. And that's such a great point. I think because it is so common, I think many people feel like, well, it's normal to not sleep well. It's normal to have sleep problems as you get older. And that is absolutely not the case. I mean, sure, there are many things that increase the risk of developing sleep problems as we get older, but that doesn't mean that it's a normal thing to experience. So I think because of that, because it's so common, many folks feel like it's normal, and then, they may decide to just kind of keep it to themselves. But you're absolutely right. This is something that is highly treatable, and there are many amazing things that you can do to improve your sleep.
And then along those lines, as you were saying, that's an interesting statistic that only about 12% of primary care physicians ask their patients about sleep. And I mean, I know primary care physicians are really busy, don't have a lot of time with patients. I'm a psychiatrist, even in psychiatry, sometimes we run into these issues where there's just not time, but it's really important. I think it's really important, not that I'm biased as a sleep specialist, but, doctors only get about 2 hours of sleep education in medical school on average, even though every one of our patients has to sleep. And like I said, many of us don't have time to go in depth into those questions about sleep. So some of the tools that I like to use, and I'd love to hear if you have any suggestions too for physicians or therapists, You mentioned daytime sleepiness. One of the things I like to do is give all my patients an Epworth sleepiness scale as a screening tool. And then if we don't have a lot of time to go into sleep in an initial visit, I'll give them a sleep history questionnaire. And have them fill that out, and we'll look at it next time, or have them do a sleep diary and we'll dig into the data next time. And I have all of this in my clinical sleep kit for healthcare practitioners because I think it's really important. But I'd love to hear what tools you like to use in your practice that might be time saving for really busy practitioners.
Yeah, so I also love to give the Epworth sleepiness scale. That's kind of my like foundational screening tool. And I also like the insomnia severity index because that really just gives us an idea of clinical insomnia symptoms and its presentation. And also along those lines, this may be a little bit more time intensive on the patient side, but I really like it because it gives us an idea of how someone is actually thinking about their relationship to sleep. And it's the DBAS, the dysfunctional beliefs and attitudes about sleep. I think it's a really great tool to use. And that's also something that I use where I can actually go in and see how each statement or belief about sleep is ranked and kind of use that as a tool to help someone build up the confidence in their sleep. So I would say the Epworth, the ISI, and the DBAS. Those are really great tools. And also sleep diary, you mentioned. I think that's probably one of the easiest things to start with. Having someone track their sleep for a couple of weeks, you have so much data there that you can take a look at and really give you a great baseline.
Great. Those are really helpful suggestions. I think I'm going to try using the DBS more in my practice now that you mention it. So that's super helpful. And I hope people will be able to take that away and try them out in their practices. So you mentioned sleep confidence. Let's talk about that a little bit. What is that? And how can you help your patients cultivate sleep confidence?
So sleep confidence is, in a nutshell, it's essentially having confidence in your ability to sleep. So even after, say, a not so great night of sleep, you have the confidence that you'll have a better night of sleep the following night, because sleep is a process, as I like to describe it, it's a self-regulating system. So your brain will do exactly what it needs to do as long as you trust in that process and you're confident in your ability. And sometimes that confidence, I'd say for a lot of folks who struggle with sleep, they lose that confidence in their ability to sleep. So sleep becomes this thing that is very stressful, and that sometimes becomes a fear. So in my practice, I like to incorporate a lot of mindfulness principles, and acceptance is one principle that really helps with building sleep confidence. So it takes a little bit of time, but it's essentially helping your patients cultivate this sense of acknowledging that sleep is a biological process that cannot be forced, and being open to being awake during the night, being open to being tired during the day. So kind of sitting with discomfort a little bit. And also, getting to a point where instead of resisting sleep, instead of putting a lot of pressure on yourself to sleep, you get to a point where you don't necessarily have to be happy about being awake at night, but at least coming to a neutral state and just kind of being open to whatever the outcome might be when it comes to a night of sleep. So that, of course, takes a little bit of time just in terms of educating the patient about mindfulness. But I would say in a simple way and to communicate this to patients would be, letting go of the need to control sleep, and instead just kind of taking a step back and being open to having a good night of sleep, kind of shifting your mindset a little bit as well. And regardless of what the night might bring, being confident that even if it is a not so great night, the following night is likely going to be a better night.
That's really powerful. And I know in practice, it can be hard to do for patients. It can be a struggle.
Absolutely. It's something that takes time, just like I would say any healing journey or changing a lifestyle behavior, someone who's wanting to lose weight or eat better or drink more water, or work out more. I mean, all of those lifestyle changes, they take a lot of consistency. They take a lot of time and patience. So it's kind of along the same lines. It's another skill to learn, but I think it's really helpful when talking to folks who have insomnia, because there is so much resistance. There's almost like this force, this effort to get to sleep. And the more that someone forces it or tries to force it to happen, the less likely sleep happens. So it's one of those things where it's, teaching this way of acceptance and cultivating acceptance to, get to a point where someone is able to build back up that confidence in their ability to sleep.
Absolutely. And, like you said, the harder a person tries to sleep, the more elusive sleep becomes. And I know you and I both love that quote from Gillian Flynn, the author of Gone Girl, which is sleep is like a cat. It only comes to you if you ignore it. And that is so true.
It describes sleep to a T. It really does. It is so true. And that's, one of the first things I like to really talk to patients about is, teaching them really what the process of sleep is, teaching them that it is something that when you learn to let go of the need to control it, that's actually when it happens. So when you're not actively trying to sleep, that's actually when sleep unfolds.
So that's a really powerful thing. And I know you talk about grounding techniques that people can use during the day. So what are some grounding techniques that people could try or that healthcare practitioners could recommend to their patients?
Yeah, so grounding is kind of an umbrella term. There are many different ways that someone can practice grounding. So I'll give you a couple examples here. So when we talk about like physical grounding, that's actually say like going out in nature and just walking in the grass or walking in the sand, stepping in the water, just kind of connecting to earth and connecting back to nature, which can be incredibly helpful. Also along those lines, just getting natural light can really help as well. So that's physical grounding. And then there are actually some very specific grounding techniques that can be helpful too, that are actually pretty quick and that, healthcare providers can share with their patients. So for example, one of my favorite grounding techniques is called the 5-4-3-2-1 technique. You may have heard of this. So you basically go through the 5 senses. And this is for, when someone may be experiencing some negative emotions around sleep, or maybe they're frustrated during the night. This is a way to come back to the present moment and essentially distract from those negative emotions, which can be really helpful. So 5 things that you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. So for the patient doing that, it's a way to kind of examine the environment, your sleep space, and kind of go through those 5 senses, again, to bring them back to the here and now, the present moment. And that can be a really great distraction from feeling frustrated or stressed or anxious about sleep. So that's one exercise, one specific grounding technique. And then there are a number of other ways to practice grounding techniques as well. So one of my other favorites falls into the umbrella of a category grounding technique. So for example, you would pick a category like movies, and then you would spend 1 or 2 minutes trying to come up with as many movies as you can possibly think of. And that really helps to kind of bring you back to the present moment. And of course, is distracting as well. Same kind of thing. It can really be any category. So movies, animals, colors, countries, different types of foods, things of that nature. So again, same idea, kind of bringing you back to the present and distracting. And then along those same lines, there are other ways to kind of do mental exercises, which can also be grounding. So for example, starting at 100 and counting backwards by 7, or saying your full name backwards and then thinking about 3 other family members and saying their names backwards. So different ways to kind of distract and bring you back to the present so that you can change those negative emotions or the discomfort that you might be experiencing around sleep.
Those are great tangible exercises that people can do and really helpful too for ruminations and anxiety, even outside of sleep issues. So thank you for those.
Absolutely, absolutely. And I would say one of the most common as well is just deep breathing. Deep breathing exercises can also be very grounding. So I think folks are maybe more familiar with practicing deep breaths, breathing in for 4, exhaling for 4, or whatever pattern might feel comfortable, but bringing your attention to your body and focusing on your breathing and trying to slow down your heart rate, that can also be a really great way to ground yourself.
Excellent. And I'm just going to adjust my lighting here a little bit more. You were talking about natural light, which is fantastic for sleep. And I'm very fortunate to have this great big window in front of me with lots of natural light, but sometimes it can be a little bit blinding. So speaking of light and things you can do during the day, I know you speak about setting yourself up for good sleep during the day, and that really starts in the morning. Could you share some strategies that healthcare providers could share with their patients about what they can do during the day to set themselves up for good sleep at night?
Absolutely. And I completely agree with you. I think good sleep begins in the morning. And some of the best ways to really help start the day off on the right track, which also, of course, helps with overall sleep quality and sleep health. Number one would be to wake up at the same time every day. So that includes weekends and non-work days. And what that does is it really just helps to, what I like to call, anchor your sleep-wake circadian rhythm or set your circadian rhythm each morning. And that can be really helpful, not only for sleep health, but for circadian health, because they are so intricately connected. So that's one of the best things to start with. And really, I'd say most people can implement that right away. Just trying to keep that same wake up time. And if it helps, setting an alarm to help stick with that. And on top of that, I would say, speaking of sunlight, not only waking up at the same time, but then trying to get natural light exposure within the first 30 to 60 minutes. First 30 minutes is ideal, but I always like to give some wiggle room because everyone wakes up at different times. So really within that first hour or so is ideal to also help set the circadian rhythm for the day. And what I really encourage my patients to do is to go outside for a walk, so without sunglasses, and so that way they can get their natural light and also get some movement in if possible. So what I like to call habit stacking. So you not only get light, but you also get to move your body a little bit, or take their coffee outside. Just spend 10, 15 minutes outside getting natural light. And that really can help set the stage for sleep at night. Then I'd say the last way to really help with nighttime sleep during the day, and this is something that I recommend to my patients as well, going back to not only the grounding techniques, but also just thinking about stress reduction techniques or stress management techniques. There's actually quite a bit of data that says if we practice, say, deep breathing or meditation earlier in the day or in the morning, that helps reduce our overall level of activation that we might be having and carrying inside the nervous system, which can then help improve sleep quality at night. So I would say those are my big 3 strategies to start with.
Those are great. And I love the point you made about regulating your nervous system throughout the day, because one of the mistakes I see people making a lot of the time when they're struggling with sleep is they're super busy during the day, they're overwhelmed, they're working, dealing with their kids, running around doing errands and chores and things. And then at the end of the day, they want to just turn off and go to sleep. And the nervous system just doesn't work that way.
No. And you're absolutely right. And to that, I say, starting off really small, because I think sometimes people feel like it's this thing that they have to do for 20, 30 minutes at a time. And that is absolutely not the case. So even for people who are really busy and have a lot going on, 1 or 2 minutes can still do wonders for the nervous system. So even just taking a minute, I mean, I know my Apple Watch, gives me that message like, hey, let's breathe for 1 minute. And even just that 1 minute allows you to come back to the present moment and still really helps to regulate your stress response within the nervous system. So even a small, quick practice, if you're doing that on a regular basis, can have profound effects for the nervous system.
Excellent. And so what if someone has tried all of these things and it's still not working? They're still struggling with sleep. At what point should they consider working with someone like you, like a sleep psychologist?
Yeah. So I would say the biggest thing to look out for would be how often sleep is disrupted. So by the time someone gets to the point where they're experiencing difficulty falling asleep, difficulty staying asleep, or a combination, or they're starting to notice that they're, noticing mood changes during the day or their performance is off. Typically what that looks like is more than 3 nights a week. So the majority of nights per week, if that's happening, and it's been more than 3 months or so, I would say that's probably a good time to seek out a specialist. And specifically, we're talking about having insomnia. So when things really do become a problem, there's short-term insomnia and then there's long-term insomnia. So short-term insomnia is often called adjustment insomnia. So a lot of people will experience adjustment insomnia if they are going through a really stressful time, or maybe they're anticipating an upcoming event, a trip, a presentation, something like that. Usually short-term insomnia is a couple nights, maybe a couple weeks, but often it's usually like a month or less, give or take. When insomnia becomes chronic or long-term, it usually is about that 3-month mark or longer, where you're experiencing this disruption majority of nights per week for that long of a time frame. So I'd say when it becomes chronic, that certainly is a time to seek out a specialist. I would also argue if you're noticing that things seem to be heading in that direction and it hasn't quite yet been 3 months, I would still say it's a really great time to seek out a specialist and intervene. I have a ton of folks who will reach out to me, even if they've been having some insomnia for a couple weeks, and it's a good time to just say, all right, here's what we can do to prevent this adjustment insomnia from becoming a chronic problem.
Absolutely. And then those are skills that they can learn to prevent other, issues with insomnia down the line if the symptoms, should reoccur. What about for other healthcare practitioners, so primary care physicians, psychiatrists, psychologists? When should they consider referring a patient for to work with somebody like you?
Yeah, I would say there's probably a couple of things. So one, when you are noticing that your patient is, either reporting that they're having trouble falling or staying asleep, or you have a patient who is taking some type of sleep aid. So especially those over the counter like Benadryl, ZQuil, Unisom, melatonin, if they're taking something over the counter and they've been doing so on a regular basis for a while, I would say that might be a good time to refer to a sleep specialist just to kind of get a second set of eyes on what's going on. And then I would say the other thing that I would also suggest kind of thinking about is, if there are any, and you might have to do some lab work with this, but any like mineral deficiencies, vitamin deficiencies, iron levels, things that might be, physically contributing to some sleep problems, I would say it also might be a good time to refer to a sleep specialist just to see if there's something from the sleep side that can be looked at.
Excellent. Yeah. And we'll be talking more about those mineral deficiencies and nutritional aspects as well in our sleep summit. So again, we'll put the link for that on the screen and in the video description. But thanks, Dr. Sarah. That was really, really helpful. I think lots of great actionable tips that people can take away from this conversation. If people want to work with you, how can they find out more about that?
Yes. So I am at Dr. Sarah Sleep on most social platforms. I'm the most active on Instagram, so you can certainly get in touch with me there. And I am right now in private practice, so I see folks who are residents of Florida and New York. So I can see them virtually, a telehealth practice. And in the near future, I'm also going to be opening up to more coaching and consulting. So that's also something to keep an eye on if you're not a resident of Florida and New York.
Excellent. Well, thanks so much for this conversation. I learned a lot. I hope our viewers learned a lot too. And yeah, I really appreciate your time.
Thank you so much. It was a pleasure.
I'd like to invite you to subscribe to this channel. This channel is all about holistic sleep education for physicians and therapists. Subscribing and liking this video is going to help get this information out to more people, so go ahead and do that. I'm Dr. Nishi Bopal. I'm a physician specializing in integrative psychiatry and sleep medicine.